Good morning, good afternoon, good evening, everyone. I'm not sure where everyone's joining from. I'm Simone Parrish with the Johns Hopkins Center for Communication Programs and the Global Health Knowledge Collaborative. And I'm happy to welcome here to this Knowledge Cafe. Gladys, do you want to say a few words?
Yeah, thank you so much, Simone. Welcome, everyone. My name is Gladys Boy. I am a member of km4dev and part of the team that co-facilitates the Knowledge Cafes. So we are so glad to have you today and welcome to our Knowledge Cafe. This is a joint Knowledge Cafe between Global Health and Knowledge Collaborative and km4dev. And for those who are joining us for the first time, km4dev is a global communities of practice where members meet, exchange ideas, and get to learn about knowledge management in the development sector. It's other also community that is open to every member, and if you would like to join, I will share in the link more about the km4dev. And right now, km4dev and Global Health Knowledge Collaborative, we started partnering recently, and we'll be having joint knowledge cafes together. I would like to hand over to Simone to take us through the next knowledge cafe about the session, and she will introduce the presenters. Over to you, Simone.
Thank you. We have with us today Natalie Apgar and Ruwaida Salem also from the Johns Hopkins Center for Communication Programs, and they are going to take us through the Equity in Knowledge Management Checklist tool. We'll do an introduction and give us some examples, and then we'll have a breakout discussion about it. Natalie and Ruwaida, would you like to introduce yourselves and take it away? And let me know when to start sharing slides.
Thanks, Simone. Yeah, sure. You can go ahead and share the slides. So thank you for inviting us to come and share the type of work that we've been doing in our project, the Knowledge Success Project, around equity and knowledge management. So my name is Ruwaida Salem. I'm with the Johns Hopkins Center for Communication Programs. I'm the Knowledge Solutions, and Natalie and I have been working very closely together over the past, actually now it's been a couple of years at least, to thinking about equity and knowledge management, what that means. It's a little bit hard to wrap your hands around, and how can we better integrate that into our work? I'm not sure.
I'm having a problem with my slide sharing. Stand by.
That's okay.
I'm going to stop sharing and start sharing again.
I think I can introduce myself in the meantime.
Sounds
Hello,
good.
everyone. I'm Natalie Apgar. I am Program Officer 2 on the Knowledge Success Project. So as Ruwaida said, I work closely with her on our project's initiative at integrating equity into our knowledge management approaches and innovations, and also developing tools for other programs to use in their knowledge management. So we'll be going over our approaches and those tools today in this session. So thank you for having us. We're happy to be here. Yeah.
Great. Thanks, Natalie, and thanks, Simone.
Yeah,
you can go ahead. Yep. You can keep advancing. All right. So we'll start with our agenda. Well, so yeah, sorry about that. So yeah, so today we'll start with just defining what we mean by equitable knowledge management. We'll provide a somewhat brief overview of some tools that we've developed, and hopefully spend some time together doing a little interactive activity. And hopefully at the end, we'll have a little bit of time for some group discussion and reflection. This meeting was scheduled for an hour and a half, so we'll see. We may not take up that whole time, but we'll see how things go. So starting first with defining what we mean by equitable knowledge management. So on the next slide, you'll see that we define equity in knowledge management as the absence of unfair, avoidable, and remediable differences in the knowledge management cycle. So, that encompasses knowledge creation, access, sharing, and knowledge use. And we're focused mostly on the health workforce. Our project is a USAID funded project, the Knowledge Success Project. And our goal is to work with family planning and reproductive health professionals so that they can find it easy to use and share knowledge in their work so that they can improve their programs. So we're concerned mostly with the health workforce, and our goal is to make it easy for them to find and share and use that knowledge in their work, and to avoid any of these unfair differences in the knowledge management cycle based on, whether these groups are defined socially, economically, or environmentally. And by that, we mean, if a group of people are defined by their age or their race, economic definitions might include things like their income or their occupation, and geographic differences could include like whether they sit and live and work in an urban environment versus a rural environment. And so if you're familiar with the health field, you may find that this definition sounds somewhat similar to the WHO definition of equity in health. And that's because we did draw heavily on WHO's definition of equity in health to come up with our definition of what equitable knowledge management is. So another way of looking at equity in KM is the flip side, the positive side, which is equity is achieved when all people in the health workforce have the information and the opportunities, the skills and the resources they need to define and participate in that knowledge management cycle. And I think a key point here is that we're not just focused on ensuring that people can participate in the knowledge management cycle, but also that they can define that knowledge management cycle to make sure that it really meets their needs. So the image on this slide is just a reminder of the difference between equality and equity. Sometimes the terms are used interchangeably, but here with equality, everyone is given equal treatment. But with equity, the focus is on equal outcomes. So equity recognizes that some groups may need more support or resources to achieve the same outcomes due to social injustices that they may experience, such as discrimination or poverty. And we think this very much applies to knowledge management as well. Next slide. So, we talk a lot about power and privilege, and a lot of these equity differences come into play due to power and privilege. So what does that look like in knowledge management, specifically in knowledge management for global health? So in the global health field, we are very much grounded in scientific methods. So we place strong emphasis on knowledge produced through health research. So we see like randomized control trials as the gold standard, for example. And so what counts as knowledge and whose knowledge counts are fundamental questions of power and privilege. So the predominant methods of knowledge management in global health that are used today were designed both by and for people with historically more power and privilege. And this reflected the society in which these methods were developed, mostly high-income countries. So this knowledge definitely is critical to improving health and saving lives. But there is growing recognition that experience and the know-how and the lessons learned from both successes and failures are also critical to ensuring that we deliver effective evidence-based interventions at scale and under real-world conditions. So what's been lacking in this conversation is that the emphasis on traditional research methods reflects those power imbalances that are inherent in the global health field. And on the next slide, we just wanted to emphasize too that, it's very easy for us to think about power and privilege between high income countries and low and middle income countries. But we also wanted to recognize that power and privilege imbalances also manifest at a regional level and a country level. So for example, health workforce members working at the central level of a health system may wield more decision-making power than those at more localized levels. We also wanted to recognize that knowledge management systems should also integrate and include Indigenous knowledge from the community members themselves that health programs are seeking to serve. So next, I'd just like to provide an overview of some of the tools that we've developed to help integrate equity into knowledge management. So we consider two different frameworks to help us do this. The first is the Knowledge Management for Global Health Logic Model. And the second is the Knowledge Management Roadmap, which Johns Hopkins Center for Communication Programs developed, which outlines a systematic process to use when developing KM initiatives. Both the logic model and the roadmap can be found in the Building Better Programs Guide and the shorter Pocket Guide version, which are located on the KM Training Package website, and we can drop the links to that in the chat during this session. So on the next slide, I'll go into a little bit of detail about each of these frameworks and the tools developed under both frameworks. So the first framework is the KM4 Global Health Logic Model. Again, this was developed by GHKC, and the goal of this logic model is to assist with planning and evaluating KM interventions in global health programs. So as with other logic models, it provides a visual depiction of the inputs or the investments that you put into KM initiatives, the processes that you follow, and then the outputs that you create. And then finally, on the far right side of the image, you'll see the outcomes that you expect to achieve as a result of all that work that you put into your KM initiatives. So this latest edition of the Building Better Programs Guide includes this updated version of the logic model, and we've integrated equity considerations into it throughout these stages, which you'll see on the next slide. Next slide. One back. Yep, thank you. So with each stage of the logic model, we noted how equity plays a role and what a health workforce member might ask when in that stage of KM. So this isn't an exhaustive list of questions, but it's something meant to get people to start thinking about equity at each of these stages. So these questions bring out questions of power and decision-making and value, especially in those inputs and processes stage. So for example, at the input stage, some of the equity considerations you'd want to take into account are whose voices are included or excluded in knowledge management systems, and who makes the decisions on the kinds of data and information that are being captured. Similarly, when looking at your processes, you'd want to consider who's involved in generating new knowledge, in synthesizing that knowledge, and in sharing it. And more specifically, consider if there's power and privilege influencing those decisions. So I won't go into a lot of detail. There's a lot of questions here, again, just meant to kind of prompt people to start thinking about these issues. On the next slide, I'll talk a little bit about the second framework that we've developed. This other framework is called the Knowledge Management Roadmap. It's a 5-step process for implementing strategic KM initiatives. It's probably very familiar to any kind of strategic planning process, starting with conducting a needs assessment and developing your strategy, and then moving on to creating your KM tools and techniques, and then monitoring and evaluating them. So we've developed a checklist around each of these 5 steps to assess equity in KM initiatives as you're designing and implementing them. This is something that our own project staff members were asking for, and we heard from colleagues in other projects and organizations that a practical tool like a checklist would be helpful for their staff as well. So on the next slide, I'll give you just a brief snapshot or example of what the checklist looks like. I won't go into a lot of details about it, but here are just 2 examples. On the left are some of the questions included in step 3 of the KM roadmap. Again, step 3 is when you're creating and iterating your KM tools and techniques. When integrating equity into this step, you want to consider things like, do your KM events, are they located in safe and accessible locations? Do you give people the opportunity to share and discuss their experiences in their preferred languages? So some of the questions in the checklist may not really come as, a big surprise or nothing like new considerations for people. But we do find that it's helpful to refer back to this checklist because sometimes it's easy for us to forget, in the rush to implement and to take action, we may forget to include some of these important details. On the right-hand side are some broader questions for you to consider in your overall KM systems. So these are questions around team roles and operations, team norms, and the resources that you're putting into your KM initiatives. So for example, here you might want to consider the makeup of your team and the leadership team in particular, and ask yourself how well they reflect the diversity and context in which you work. So taking into consideration things like age, gender identity, race, nationality, etc. On the next slide, you'll see here that we identify 4 essential elements for effective and equitable KM tools and techniques. So within step 3 of the checklist, we've organized step 3 of the checklist based on 2 broad categories of different types of KM tools and techniques. So we see KM tools and techniques as focusing a lot on either asking and telling approaches where you give people a space to interact with each other and share knowledge with each other and ask questions of each other. And then the other type of KM tools and techniques are more of the publishing and searching. So these are more like the websites and publications where you can share explicit knowledge with a wide range of people. Within those categories, we think that there are 4 essential elements to consider. Are these KM tools and techniques available? Are they accessible? Are they acceptable? And are they high quality? And again, we've adapted these 4 essential elements from the essential elements of healthcare services. And so by availability, we mean that knowledge is available in a wide range of formats. And there's a constellation of different types of KM tools and techniques available to everyone in the health system. And by accessible, we mean that everyone can access knowledge and the KM tools and techniques at no or reasonable financial cost and consistent with their needs. So accessibility is not just about cost, but also things like technology, the format of the KM tool and technique, language considerations. So are they accessible in those terms? For acceptability, we're looking to see if the knowledge products and the KM tools and techniques are respectful of culture and sensitive or responsive to people's identities. And specifically, we want to make sure that they don't reinforce inequitable gender or other power dynamics. And for quality, we want to make sure that the knowledge and the KM tools and techniques are accurate, they're up to date, they're unbiased, and they're relevant to the audiences that you're trying to reach. So I will stop there and pass it over to Natalie, who will provide some examples of what equitable KM can look like. Natalie, over to you.
Thank you, Rueda. So yes, as Rueda said, I'm going to walk us through some examples of equitable KM. I'll share some examples of what our project has been working toward, as well as examples from other organizations that we've partnered with in Sub-Saharan Africa and Asia. So the next slide, please. Thank you. So internally at Knowledge Success, teams have been using the equity checklist and have identified the following strengths, which I'll just briefly go over. So web accessibility and language is a big one for us. As a lot of you know, a Knowledge Success it is a website. Primarily, we have blogs, lots of content pieces on family planning and reproductive health. So we know that, because the web is fundamentally designed to work for all people and, be available as an accessible source of knowledge, it's very important that we make sure our website considers disability and design in its design and the way that it's presented. So we work hard to make sure that people with disabilities can access our websites, tools, and other platforms. For example, we always include alt text and web images, making it easier for people with screen readers to understand our content. We also have been publishing audio versions of blog posts so that people can choose to listen instead of read. And I want to acknowledge that, this is certainly an area where we still have more to learn, but we are working on making sure that we're removing barriers in our website accessibility and inclusivity. Language inclusivity is a big one in this too. So in this screen grab, I'm showing that the Knowledge Success website is available in 11 different languages via an auto translate plugin. And often our content is translated by a human translator into French. And in terms of authorship of content pieces and images, this is something where we've really tried to be very transparent with a focus on giving credit to those who've developed it. And for that reason, you may notice that many of our blogs often have 4 or more authors. That's because we're really trying to give credit to all of the people who played a role in bringing the content piece to the web page. So these are just some key strengths that we've pulled out among our different teams who've gone through the exercise of completing the equity checklist. And of course, there's varying points that came across depending on the team and what specific knowledge management approaches or outputs they're creating. I just wanted to highlight these main points. Next slide, please. Next slide. Thank you. Oh, yes. So of course, we're happy to report the equity strengths that were revealed from the use of the checklist. But I also wanted to go over just a few areas of improvement that were revealed. So in general, we want to note the need to create time and space for these types of discussions within teams for each and every activity. When starting to plan an activity, as Rueda was alluding to in her slides, it can be really challenging. It can be easy to overlook these points that you might think like, oh, of course, we're doing this, we're considering this. But when there's a lot of to-do items to get an activity up and running, it's actually easier than we realize to overlook some key questions, such as, are we ensuring an equitable gender breakdown of participants and facilitators? Who are we reaching or who are we not reaching with our chosen approach, and what can we do differently? Are just some important questions that we want to make sure we're creating space to ask ourselves. We also have some areas of possible growth in terms of disabilities. So we realize that we are not always acknowledging disabilities that can affect participation in online events or other knowledge sharing opportunities, which represents a large part of our program implementation. So we're trying to think of more ways to get more inclusive in this area. We've started asking before online events, we've started asking participants if they do have a disability that may affect their participation that they want to let the facilitators know about. And this is something that we're going to continue integrating into our work. Equitable partnership is also one that's come up for us, trying to reflect on the partners that we're engaging with for our activities, making sure that we are continuing to strengthen and grow the relationships that we've built, while also not creating a pattern of convenience where we continue sticking with maybe the same partners or same groups, communities of practice, working groups. We want to make sure that while we're continuing to nurture those relationships, we're also making sure that we're not missing some other key groups in the countries where we work, and see how we can expand even further. asking ourselves again, whom may we be missing? And finally, we want to continue supporting and strengthening opportunities for co-creation of activities among our audience, among the FPRH technical community that is inclusive. So one example of how we've taken action on this is in the past work plan year, we sent out a call for youth content writers, inviting youth to apply to write blog pieces for the Knowledge Success website, and we offered stipends for their time. And these youth were based in Africa and Asia. And we've developed, I believe, about 10 blog pieces are now published and available on the website that you can go and check out. We know that youth representation in FPRH is essential, and as the flagship USAID knowledge management project, we know we have a key role to play in supporting their participation in knowledge creation and sharing. Great. So with that, I will now go in on the next slide, please, Simone. I'm going to share a few more examples from other projects that have implemented equity in their knowledge management innovations. So I'm going to give a brief introduction about the pitch competition. The pitch is a competition that is part of the Knowledge Success Project, in which we basically fund awards to different innovators, KM innovators, we call them, to implement knowledge management innovations for family planning and reproductive health programs in their contexts or in their communities. These are often smaller organizations working in sub-Saharan Africa and or Asia, and really excited to be sharing some examples of recent season 2 competition. These groups did not necessarily use the equity tools in their innovations because the tools hadn't been published at the time of implementation, but equity was one of the selection criteria that the judges considered when awarding the winners of the competition. So you'll hear soon that some of the issues raised in our equity tools, like considering your audience's language preferences and format needs, are aspects that the pitch panelists addressed in their KM innovations. For season 2, I'll just share that we received over 80 applications for the competition. We narrowed that down to 10 semifinalists who were chosen to pitch their innovation, that's where the name comes from, to a panel of global judges who ultimately selected 5 KM champion innovators. Next slide, please. So I'll first share about the Blind Youth Association Nepal, which was one of the winning KM innovators. This organization developed guidelines on disability inclusive FPRH services. Through this, they sought to reduce barriers to accessing family planning and sexual reproductive health services for people living with disabilities in Nepal. And these guidelines were developed specifically for service providers and government officials. They then trained over 1,000 providers on the guidelines using a cascade training approach. Next is the Population Foundation of India. This organization developed a Hindi language, family planning, SRH knowledge bank or resource bank. And the picture on the slide just shows a screen grab example of what this looked like. We'll share a link in the chat. You can read more about all of these innovations on the Knowledge Success website. We have a recent blog post where we went into more detail on these innovations. So this knowledge bank bridged the gap in knowledge among family planning and sexual reproductive health in the media, in specifically the Hindi-speaking North India states, by translating verified data and information into Hindi. Facilitated greater awareness among journalists, key decision makers, civil society organizations, community groups, frontline workers, and the population at large about family planning needs and services. The third innovation on the next slide is a Projet Jeune Leader from Madagascar. And this organization developed a digital and print magazine in both French and Malagasy to share community feedback about youth FPRH, you know, what was going on among group youth, what they were talking about, their needs, their feelings and attitudes, sharing that specifically with national decision makers. So creating this line of communication among those two groups. This critical feedback loop was created, and we have a screen grab here of one of the magazine articles. This one was in English, but they were primarily also French and Malagasy, as I said. And then we have Save the Children Kenya innovation. Save the Children Kenya developed a centralized family planning dashboard with easy to interpret analytics that national, country, and sub-country program managers and other professionals could put into action. And one more on the next slide is Strong Enough Girls Empowerment Initiative, or SEGI for short. They produced a multilingual Indigenous storytelling podcast series. They really tried to position young people from Indigenous communities in Nigeria and Niger as problem solvers and family planning experts. And they used the Indigenous storytelling approaches or traditions in their podcasting. And they also included a diversity of languages beyond the colonial languages of French and English. They included Igbo and Pidgin as well, which I personally felt like was a really groundbreaking example that was exciting. So I think we've shared in the chat the blog post. You can get more information. Thank you, Rueda, for doing that. I'm also going to pop in the chat. Rueda and I spoke on a webinar in August, I think, or September, a webinar hosted by Data for Impact, the D4I project, where we presented on these tools as well. And then the pitch, 3 or 4 of the pitch innovators actually joined as guests on a panel, sharing more about their innovations and answering questions. So I've just shared the link to where you can find the recording for that. Great. So with that, we can go to the next slide, please, Simone, and we'll just open it up for a few questions from you all before we go into the breakouts, where you all will have an opportunity to discuss the equity checklist more, but we wanted to make sure there weren't any questions before we did that.
I see a hand from Sarah Cummings.
Can I go ahead, Simone?
Yes, please.
Great. Well, Rueda and Natalie, I'd just like to really congratulate you on this. I think it's absolutely fantastic. And I should really know a lot about this already because, oh, my battery's running low. Hopefully I can finish my comment before my computer fails and then I'll load it up again. But really absolutely fantastic. And yeah, I should know about it because of the article in the journal, which I posted in the chat. But like, I think this is got relevance much beyond sexual and reproductive health. And it would be fantastic if all websites and all knowledge management initiatives would use your equity checklist. So yeah, so I just wanted to comment on that. Fantastic and really great to have heard more about it.
Thank you so much, Sarah. It's Really great to hear that feedback. Thank you. Yeah, we're working, in the past year or so, we've been speaking on these different online events to make sure that we are disseminating and sharing equity checklist. And we've shared the link where you can find it on the KM training package, which is sort of built for a more general audience in knowledge management. So we do hope that different groups and audiences can find it useful.
Yeah, maybe just one actual question really related to translation, that obviously calls for a lot of resources, and I think you're using some sort of automatic translation, but what sort of level of resources are you having to put into translation? Totally recognize that, totally agreeing with you, as I think many of us here would, that actually it's a really, really important thing to reach different constituencies to have this.
Yeah, thank you. That is a really important comment. We know, translation can be expensive, not just expensive, but also timely. So there are a lot of resource inputs that go into it. We found that there can be some, lower resource ways to make content more accessible in different languages. For example, there's different online translators that are free to use, and they've gotten pretty good. I think the plugin on our webpage, you pay for the year. I don't think it has a large cost associated with it, but I'm not completely sure. And then things like live interpretation on webinars, of course, are much more costly, which is often why, we see a lot of organizations choosing to do that maybe for 1 or 2 languages, but it's harder to do it for multiple languages. I know that there's more technologies coming out with artificial intelligence where you can put a recorded audio recording and get the dubbing back in the different language, which is really exciting. And I think we're going to see even more technologies like that as they come out, maybe more affordable.
Yeah, and I just wanted to add too that I think it's really important to define who your audience is and then make sure that you're meeting their needs, because you obviously can't meet the needs of everyone around the world or in your country, however, the scale that you're working in, but really to think about who your specific audience is. And that's the first important step, is to define that very clearly and specifically. So in our project, our key audiences are in sub-Saharan Africa and in Asia. And we know that in sub-Saharan Africa in particular, that French resources are very much needed. So we definitely prioritize French, and we make a point to budget for that in all of our webinars to have French interpretation, and we translate all of our key resources and actually have a human translator. And sometimes we actually create original content in French as well. And we get French speakers and French writers to write and speak in their own languages. But we do depend on technology and tools to provide, automated French translation for the wider scale of resources like on our website. They're not perfect, but I think they are getting a lot better. I'm looking at Simone because I think I remember an old example where we would translate the term brief, which, like as in a fact sheet brief kind of thing. And it was translated a long time ago. I hope it's not still translating it that way, but as underwear. So there's definitely, sometimes you need a human eye on these things for sure.
I have a more recent example. The base plugin is very inexpensive, and the translations, while they get charged by the character, you can set a throttle point, so up to a certain number of characters it's free. But the recent example I have of why you really need human reviewers on your automated translation is another project I work on. The READY initiative has an e-learning course called WASH in Epidemics, standing for Water, Sanitation, and Health. And that was translated into Amharic as bathing in a plague. So you really need someone who speaks that language to review your language translations. And most of the translation plugins have a way that you can choose specific phrases and have them be translated to
Mhm.
something specific. So you don't have to just put up with whatever the automated translation is.
Right. Yeah, that's a good example, Simone. Great. Well, maybe we can move into the small group activity for those who can stick around. So Natalie, did you want to go ahead and share what
Yes,
we'll
great.
be doing?
Simone, if you could put the next slide up, please. So for this small group activity, in the next slide, thank you. We are going to be asking you all as knowledge management experts to help us get feedback on the equity checklist by testing it out and letting us know what you think, sharing your thoughts. So working in a group to talk about what you think about the easiness or the ease of understanding different questions, basically. So we'd love to get your feedback on the entire checklist, but to make it more feasible in this space, we're going to focus on step 3. And this step is where you create and iterate your KM tools and techniques. So we're going to make random assignments into smaller groups. And when you get into your groups, we'll ask you to do 2 main things in a Google Doc. So first, individually rate each checklist question by typing an X in the appropriate column, and you can see the screen grab here. So you'll type an X on what you think about the comprehension of the question and the validity of the question for integrating equity into knowledge management. And then as a group, you'll discuss the reasoning for your ratings and document any important points in the notes columns. So individuals can feel free to adjust their rating after group discussion if your assessment of the question shifts after discussing. You can refer to the companion how-to guide, which is available on the KM training package website. I think Rueda is going to drop the link in the chat. And this can give you guidance on how to answer any of the questions. We tried to keep the questions in the checklist itself very broad, so they could be applied to lots of different contexts or scenarios. So the how-to guide can be helpful in understanding how to answer the question. So in the next slide, I'll just share a little bit more about how we've organized the groups. So as I said, we're focusing on step 3, which is organized into 2 broad categories. The first category is asking and telling, or the top half of the matrix that you see on the screen. These approaches are where people have the space to interact with each other, share information, and ask questions either face-to-face or virtually. Examples include peer assists and share fairs, conferences, and meetings. And then the second category, or the bottom half of the matrix, consists of publishing and searching techniques. These are KM tools for documenting explicit information and sharing it with large groups of people. So things like websites, publications, taxonomies, and even libraries fall into these categories. So for each category, the checklist questions consider 4 essential elements for effective and equitable KM. These are the AAAQ measurements that Rueda shared. So we'll use these categories to assign people randomly to different breakout rooms. So you only need to worry about the group that you're assigned to, and the group will correspond with which KM tool and technique you're focusing on and which measurements. So if it is of the AAAQ measurements. And this will all be, you will have a Google Doc that will have these instructions again and make it very clear which group you're in and what you're focusing on. So group one will look at asking and telling approaches, specifically the questions related to availability and accessibility. We have all of the questions in the Google Doc, like the whole checklist for the rest of that asking and telling, but you only need to focus on the ones that are not grayed out. But if you have extra time, you can go further. Group two will look at asking and telling approaches with the questions related to acceptability and quality. Group three will tackle publishing and searching with the availability and accessibility attributes. Group four will be assigned to publishing and searching, but we'll look at acceptability and quality. And then if we have a need, we do have a possibility for a French language group. That this would focus on asking and telling with the availability and accessibility. So if you would like to be in a French group, if that's something that's of interest, maybe can I get a raised hand or put it in the chat, because we would like to make sure that there is a French group, and you'll have the ability to self-select. We just weren't sure if that was going to be needed. So you'll have about 30 minutes in your groups, and don't worry if you don't get to all of the questions. If you do have extra time, feel free to explore the grayed out questions related to the other two attributes for your category. We'll come back from the breakout rooms after about 30 minutes, and then we'll have some time to reflect together as a group. And we're hoping to really just get a conversation among us. Like I said, you know, we're excited to be presenting on this platform, the km4dev platform, because you all are knowledge management practitioners, and we would love to just get a dialogue going about the checklist and what you think about its usability. Okay.
And we'll be moving into the breakout rooms just to see if there's any questions, and we'll share the Google Doc link once. I think it'll probably be easier once we get into the breakout rooms. But if anybody would like a French room, please, you know, let us know so that we make sure that we create that space.
If I'm not seeing any hands for a French group, if we have a French group, I'm going to need to assign people to breakout rooms manually. So last call, if you would like a French group, please raise your hand or say in chat that you would like French group.
Natalie is a French speaker, so she will definitely be able to come in and facilitate that group if need be. Okay.
I'm going to go ahead and have the Zoom assign people automatically to the 4 breakout rooms.
Sounds good. Thank you, Simone. And yeah, as Rita said, each one of the facilitators, Simone, Gladys, myself, and Rita will be in a group, get you started and answer any questions.
Okay, the room should be open. Oh, I think I need to reassign people. Hang on. Calvin and Adamo, do you need help joining a room? Or if you prefer to just hang out in the main room, that's fine as well.
Yeah.
Okay, hi, main room. I just set the 60-second timer off, so people should know that the breakout rooms are closing. Oh, sorry, I just saw this question.
That was a surprise return.
Sorry.
Oh, yeah, sorry, we may have gotten a little cut off, and some of you may have been cut off. We just wanted to make sure that we had some time in a larger group. Let me go to the slide. So I think we don't need to put this up on the screen. Simone, you can take a break from screen sharing. Maybe we can all just have a discussion now. So we'll start more broadly. What were your impressions overall of the checklist? Is there anything, any general reactions that anyone is open to sharing with the group?
Well, maybe what I said in our group, I think it very much depends on the context, the type of group, the type of people you bring together, whether it's very formal, informal, whether people are relaxed or so. But some are clearly essential points, and others, maybe less. Like if you pronounce a name wrongly, can also be fun the first time, and then the person who did the mistake probably will quickly correct.
Thank you for sharing. Are there any other reactions now that you had a chance to dive in a bit to some different questions in the checklist?
I can share an overarching reaction. Even though I'm coming a little bit from the inside, I've been exposed to this checklist before, but even going through this exercise, I was looking at the validity questions and is this essential to measure equity? And my instinct was like, of course, yes, this is essential. And then for many of the items, I was in the asking and telling approaches group. But then when you think about it from a resource perspective and what your ability is to be able to implement, that might be a different answer. You might say it's useful but not essential because resources may be scarce and you can't do everything.
Yeah, that's a good point. And Simone, it sounds like you were in agreement.
Yeah, that came up in our group as well for a couple of questions about, for example, the different types of formats you can offer things in. A lot of these people's initial reaction was, well, if we have the budget, like it really, you have to make some choices within your program context and your budget level about how many different formats you can afford to produce.
Sarah.
Yeah, so we had a really nice discussion in our group, but a couple of things, for example, I mean, we were looking at publishing, I think, and I forget now the terms that we were using, but one of the things I thought it was talking about diverse backgrounds, the need to, include people of diverse backgrounds. but I thought that was a bit, it should be more explicit. I thought, I mean, don't get me wrong, I think the whole thing is really great, but it could be more explicit about sort of different intersectionalities, different nationalities, you know, different color of skin, different religious background, so that, you know, the way it's described in the minute, you could have probably, you know, there might be a risk you could get away with a male panel, for example, like that. So I think it would be really good to have that more explicit. And also some of the, maybe, you know, you could also link some of the terms to things which are probably in the text version, like what do you mean by interactive KM? What do you mean by diverse participants? What do you mean by their knowledge? I mean, I'm sure they're all described in detail, but you could, one of the great things is if you have an HTML document, you can link to all of these different things if people have questions. But yeah, thanks very much.
That's a really good point, Sarah. Like, I think we're limited in this PDF. You know, the published version is a PDF version. So we did develop like a companion how-to guide that draws out some of those that specificity in terms of like, what do we mean by diverse backgrounds? But it's like, how do you like toggle between the two and make something like more general and applicable to a wide audience, and then add more details for somebody who wants them? But an HTML version could definitely make that a lot easier. I did want to ask a follow-up question, that something around what Peter had asked, which is, you know, kind of really just depends on the context, which I think we definitely don't totally understand. And this is something we've been grappling with in terms of like how to make the checklist applicable to a wide group of people. But recognizing that not all of these situations might apply to all, you know, to all people in different contexts. And so like balancing the need to be somewhat comprehensive, but not overwhelming too, you know, not wanting to make it overwhelming. So if there's any feedback about like, you know, did you feel overwhelmed with the number of questions? Like, did you feel like, gosh, why are you asking me all these things? Or like, or I'm so glad that you touched on all of these different things, and I'll pick and choose what makes sense for my context.
Yeah. I think when I first saw the KM equity checklist, for me in my head, the word checklist implies something very simple, like one page. And so I was a little bit taken aback that there were as many questions as there were. And then reading the questions, I could viscerally understand that most of them would be necessary for really assessing KM equity, but I almost feel like it would be useful to have like a quick and dirty version of like, these are the top 5 considerations. If we can, I don't know if we could narrow them down that far, because different considerations are more or less important in different contexts. But yeah, having a like getting started version might be useful.
Yeah,
A
that's a good
pocket
point.
guide.
Yeah, exactly. Exactly. It's exactly the same as that. Yes.
Good point. Checklist light version.
Do we want to talk about any of, since we're
Peter.
Yeah, no, look, I know you, I don't know your project. I understand you work in several countries, several parts of the world. But indeed, the checklist, I think it's okay that it's long, because you as a responsible user of the checklist will have to decide which ones to include, well, not, which are essential, which you think are maybe not. And then I say you. The question is, of course, with whom do you work? Who decides at all? And isn't there some risk of supremacy there as well? If it's
Exactly.
project managers that decide without involving all the other stakeholders, you also have a problem, right? Which is not easy to solve.
Yeah.
Right. And then if you tell people like you pick and choose what makes sense, like they might take out things that they just don't want to do at all. Right. And so we don't want to risk that as well.
Gladys, you have a hand up? Oh, you're muted.
Yes, I needed to have something on what Peter mentioned in terms of having stakeholders being involved, which is so important, especially when it comes to local context. Like now in Kenya, recently there's the conversation on digital health. It's gaining a lot of debate, and it's a concern to all of us. Digital health in the global health, which looks like the local context, the people are not being informed about this. What is it all about, the digital health? How is it going to infringe their rights? And if the locals say no, does it mean that you're going to withdraw your support to these from the equity deserving groups? So it's an interesting conversation as we speak about this, and also how the equity knowledge management, we need to be the champions and taking the lead to provide the right information to the right people at the right time, and make sure that these diverse groups are part and parcel of the decision making, so that when we are coming up with something or any projects that involves the locals, they have to be part of it, and we need to explain to them what is it all about. So yeah, it's an interesting, and I like the checklist, the KM checklist now, which it's like creating a roadmap even for other global health projects, that they need to use it while developing such initiatives in the local context.
Thanks. I think that's where we'll wrap up. It's 10:30. Thank you everyone so much for a really vibrant conversation. And we will post the recording to the km4dev list when we have it. Thanks everyone.
everyone.
Yeah, it's
Appreciate
a
it.
great way to end. Thank you very much.
Thank you.
Bye.
Bye,
Thank
everyone.
you.
Bye-bye.
Bye.
Bye,
Thanks.
thank you.